The Hindi-Urdu Flagship program gives us a tremendous opportunity to develop resources for the studying and teaching of these two languages. And for those of us who've been working in this field for quite a long time, it's a very exciting opportunity. And especially when we see something as innovative as the Language for Health program, we feel very glad that we've been given this opportunity. The Language Flagship funds a number of different flagship programs throughout the country, approximately 24 in number, and they are typically in languages like Arabic and Korean and Chinese. And here at the University of Texas at Austin we have two flagships. We have the Hindi-Urdu flagship and an Arabic flagship. So in the Hindi-Urdu flagship we teach Hindi and Urdu, these two sister languages, side by side in parallel to undergraduate students who take it as a 4-year program, and they spend their 3rd year studying at a specially designed intensive program in India. So it's 4 years with 1 year in India. So the internet has become a really natural resource for us to develop materials, partly because it's part of our mandate to develop learning and teaching materials for the wider audience, for people wherever they may be studying Hindi and Urdu, and partly because it's for a long time been the need of the hour, so to speak, to move beyond just written, published text resources and to develop things which can help people become really proficient as listeners and speakers of the language. So the kinds of live materials that we can develop through the web have been an essential part of this, and it's something we've spent quite a lot of effort on. This is the context in which the Language for Health initiative has become so important. And although we have done a number of different things in various different kinds of media, this is by far our most ambitious project to date.
One of the goals of the Language Flagship is to build bridges between the university and the government and the business and the NGOs. So by building this website, we are opening ourselves for this kind of bridge building so that doctors, researchers, as well as NGOs, besides our students, can use this website fruitfully. We went to India and we conducted a number of interviews with various kinds of doctors in urban areas and rural areas, with Ayurvedic doctors, with allopathic doctors, with Unani doctors. And we tried to capture how they interact with their patients, how they diagnose them, how do they prescribe their medication, what is their nature of interaction with males, what is their interaction with females, and so forth. And then, based on those video shoots, we developed clips which have their transcripts, which have their word lists, and which have got exercises associated with them. So this makes for a basic module for a language lesson which is focused on medicine. So in a sense, the video, the word lists, the exercises, and the transcripts, they make for a very comprehensive pedagogical module for learning language as well as culture. So when we were applying for funding for this project, we decided to make it as collaborative as possible. So we contacted our colleagues at New York University and Columbia University, and then came up with a plan of what this project would look like. And I was particularly enthused by the medical aspect of it because several of our students pursue the medical field.
Being a student in the flagship is hard work. It's an intensive program. We deliberately make it so. We have a lot of ground to cover. But also we give a great deal of support. The student-staff ratio is extremely favorable. People get a lot of personal attention. The classes are small. They get all kinds of practice and, I would say, privileges in their learning experience. And there's also the, I think, rather special feature of being part of a quite small program within a very large university. So there's almost a kind of family feeling, a very strong feeling of identity within the program, and I think that it counts for a lot in terms of the student experience. It certainly helps them through the rigors of the program to know that they have a great deal of support from staff and faculty and fellow students. Well, all of our students, apart from taking the Hindi-Urdu flagship, are also pursuing their own majors. And many students, for example, are interested in business. Some have the intention of going to government service after graduating. Others may want to work in NGOs or in the health field. So we have a number of different career paths that our students are following. And we try and help them develop those even while they're still studying here. For example, in our year in India, our overseas year, which is the third year of their 4-year program, they all pursue professional internships, working in Hindi-Urdu speaking contexts and hopefully pursuing areas that they're interested in getting into themselves when it comes to graduating and entering a professional life.
And then once I began to develop the video clips and the assignments associated with it and the exercises, I realized how invaluable a resource it becomes, especially in the field of Hindi and Urdu, where we are always trying to develop new live resources which are non-text based, so students can actually use them in their normal real lives. I was completely sold to the project. Clearly, if one is a language student, they would need to be of a certain level before they can make full use of the lessons on the website, because this is a website which has clips from interviews which are spoken in colloquial manner. And so a student would have to be, say, advanced mid and above to make full use of it. But then there are so many variations and registers and dialects associated with all those video clips that a good student would be able to make immense use of them. So that is as far as teaching our students is concerned. When it comes to NGOs, those NGOs who are already functioning with Hindi and Urdu will have no problems working with the material over here, or government organizations or business organizations who have designated individuals to work with Hindi and Urdu for research purposes or for other kinds of in-house communication purposes will find no difficulty using this website.
There are a number of different universities teaching these languages that have developed some excellent online resources. To my knowledge, this is the only one which addresses specifically the health and medicine context.
Health and medicine is one socio-cultural aspect of human life which actually transcends all politics. And yes, our website brings this out very at a very elemental level, how people interact with their medical practitioners, even if they are of different religions or of different languages.
One of the functions of our website is to reach out to everybody who's interested in the fundamentals of this project, who is interested in seeing Hindi and Urdu being taught and being studied to higher levels. And we welcome contact with all sorts of people from business and from other educational institutions who would like to share in this project, and we look forward to hearing from them.